Namaste everyone, this is Dr. Meenakshi. Welcome to Dr. Meenakshi's Medica. So, now we will hear another complaint of pimples or acne, especially in teenagers and adults, especially this 14 to 20 years age group, or nowadays more than 20 years also, 20 to 25 or 26 years adults also we are hearing we have many pimples or acne, what we say in medical term, acne in my face, and they are getting scars and they are getting mark on face. So this is a common complaint now for nowadays teenagers or adults, right? So today I took a topic of pimples or acne. So what are these acne? We'll see, and how they cause and what the treatment we can give, we will see. So especially what are these pimples or acne? Pimples are nothing but in initial stage we will say them, or in mild stage we can say them pimples, but when they form this acne in chronic stages or in severe conditions, they will form as acne, or medical term for pimples we can say as acne. So what are these acne? A skin condition that occurs when hair follicle plug with oil and dead skin cells. These acne is most common in teenagers or adults. When this skin condition plug with or combines with oily content and the dead skin cells, they form a papules or pustules or a swelling, they form as a pimples or acne. So the incidence is very common, that is more than 10 million cases per year in India. And what causes this acne? What are the causes? So excessive oil production of skin may be. Four main causes are there. First thing is oil production, more oil production on your skin, or hair follicle clogged with oil content and dead skin cells, they cause inflammation. And third one is infection of bacteria, especially bacterial infection may cause pimples or acne. Or fourth condition is inflammation due to again infections. These four conditions causes the pimples or acne on your face. Not only in face, again it depends on the medical condition and severity of your causes. Some people will have these pimples or acne or scars in other parts of body also, like maybe back or chest or the extremities, especially upper extremities on arm region. These all they may get as a pimples or acne, but especially initially it will start with the face. So these pimples are of four types. Four forms of pimples we will get, or the patients will get, has papules, pustules, nodules and cyst. These pimples are in four types or four forms. These papules and pustules we can treat or we can cure them in home only with the lifestyle changes or with the diet changes we can cure them. But whereas cysts and nodules we need a medical treatment, then only we can treat them. And these are the types. And the main we saw the medical causes why they cause pimples or pustules or acne. But what are the some steps we have in daily routine we will follow in a wrong way, so that it will lead to formation of pimples or acne? What are those? We will see. Highly main 12 points are there in our daily routine. Everyone will do these mistakes and they will lead to cause of a pimples or acne. What are those? We will see. That is, first point is washing your face too often. You may be thinking what she is saying, what this doctor is saying, washing face is good for skin, then why she is saying not to wash your face, right? You should wash only twice with the soap or face wash, or without soap or face wash you can wash your face with the plain water maximum 4 times, that too if you sweat, or else only twice washing your face is sufficient. You should not wash your face too often. That too can lead for the pimples or acne. This point you were not knowing, right? Then exfoliating too much means exposing a skin for the medications, or exposing to the sunlight, or exposing to the dust, making it infected is, if you are following this, it will lead to causes pimples or acne. Using dirty towels or cloths to clean your face, this may lead to infections, again it may lead to pimples or acne. Or using wrong medications for your acne, or not only medications, using wrong products for your skin according to your type skin, or changing your acne medications too frequently. Like if you are using one product, you should use for the longer duration, then only it will give a result. But what are people will do, they will use for 3 to 4 days. If they feel it is not reducing or it is not causing any changes, again they will change the medications. This if you do oftenly, then it will lead to the increase in pimples or acne. And another thing is, what frequently we will do is squeezing out or bursting the pimples. It leads to increase in the formations of pimples or acne. We should not squeeze, or you should not burst out the pimples, and you should not remove the, or you should not poop out the pimples. It will lead to the increase in the pimples or acne. And sleeping with makeup, whatever you maybe had a strong makeup, or you maybe had a light makeup. If you had a makeup, or if you use any skin products, you should wash it immediately after going home. If you sleep with the makeup, then it will lead to the infections, and again it will lead to the pimples or acne. And touching your face repeatedly, you should not do this, because wherever we will touch our hands, it may be dirty or it may be dust, anything. If we touch our face repeatedly with hands, whatever germs or whatever dirt or whatever infection we have in our hand, we will transfer it to face. Again it will lead to pimples or acne. So you should not do this. And eating too much sugar or carbohydrates, again it will lead to the oil formation, production of oil more, and it will lead to the pimples or acne. So these are the steps which we do in a wrong way, or which we do the mistakes, so it will lead to the pimples or acne. This acne is very common issue for many people, especially teenagers and young adults, as we know, right? But adults in their 20s, some have mild symptoms, or some others can have very severe acne. Everyone will across this pimples or acne in their teenage age group, especially in 20s, but some will be having mild, like 1 or 2 pimples they will get and it will disappear, because, and some will follow, some will have the severe. Here why it differs, because one, it depends on the prakriti of a body, and another thing, the steps which we saw in last topic, 12 steps, if we are following in this wrong way, so it will trigger these pimples or acne, and it will create a more acne. But especially 90% of adolescents will have this acne or pimples problem, especially the age group is 12 to 20 years, especially the age group of 12 to 20 years, kids or adults will suffer with these pimples or acne. So everything will be having some solutions, right? So what steps we should follow to reduce this acne or pimples? We will see. Some in mild conditions, has age prefers or age moves after 20s, it will reduce itself, self-limiting. But the people who are having the severe conditions, first give acne treatment at least for 4 weeks, as we saw in causes or steps. If you change repeatedly the treatment or medicines of the acne, it will not reduce. So use continuously at least minimum 4 weeks to see the changes or see the results, then you decide whether to change or continue. Then attack the cause of acne. As we saw the causes of acne, you prefer that whatever, not only in acne, whatever the health issues are there, the basic is causes. If you spotlight the causes, then obviously your whole complaints will be reduced. And as I said, wash your face only twice, or if you sweat then only you should wash your face. Stop scrubbing your face too often, and especially the another mistake what people will do, that scrub their skin very often and too hard. You should not do this. You scrub your face mildly. If you are facing with the pimples or acne, then don't scrub your face. It will trigger the pimples and it will lead to increase in pimples or acne. Use skin products which suits your skin type, because as we know we have many skin types: oily skin, dry skin or mild skin. First find out your skin type, then use a product. Or if you are not getting how to find out your skin type, use a product for minimum 4 weeks. If it's suiting your skin, then only you continue it. If it's not suiting, or if you are getting any side effects, then automatically change your products. Or another thing is, you can consult a dermatologist and you can know your skin type, then go for the skin products. Resist touching or pricking or pooping the pimples. If you repeatedly touch the pimple or poop the pimple or burst the pimple, again it will trigger and it will increase. So stop this. Then at last, these all are home remedies or the daily routine lifestyle which we can change to reduce our pimples. As I said, if you change all these lifestyles or these steps to follow, automatically the initial 2 stages, papules and pustules, will decrease the condition. But nodules and cysts will not decrease only with these lifestyle changes. So you have to consult a dermatologist, and you can have a skin care kit or cosmetics which suits your skin and which reduces the pimples. Here I am not mentioning particular medicines for the pimples or acne, because it may be any type of pimple or acne. The single product will not will be applicable for all skin types, as I said, right? So you should consult your dermatologist. They will know your skin type and they will suggest you the cosmetics or skin products which suits your skin. So initially change all these steps and see if you are facing in initial stage of pimples and acne, then it will be reduced automatically. If it didn't reduced, then consult a dermatologist and have the skin care kit or products. Thank you.